It has to do with you have to prevent. You have to prevent. You have to take care of yourself. And it doesn't all come down to how you feel on the outside. And so we want to do this show. We're going to be sitting here, guys. You want to share this, find us on Doctors Warren on Facebook. But the reason why we want to do this show is because there's a lot of fear. You know, gosh, man, like I read something like this meme that talked about how, you know, every day we're hearing this death count, right? Like all you're hearing is this negative and negative thing. We're not hearing about people that are beating it. We're not hearing about treatments that are working, like vitamin C. You know what's really freaking annoying is that I was looking up about vitamin C, and we have seen some extraordinary things about vitamin C, like stuff like, you know, how it helps like with cancer and what it does inside of your body. It's because we're so depleted of it. And you know, it's funny, if you Google vitamin C and coronavirus, all you find is negative freaking articles. All you find is, you know, vitamin C can't cure coronavirus. But then when you click on the article, it says that it has been shown over and over again to decrease the severity of a viral infection and to make the symptoms milder. What the heck? Okay. Yeah. These articles are saying, hey, vitamin C won't cure coronavirus, but it'll make it, you know, not as intense. It'll make it last less. What is the biggest issue we're seeing right now with coronavirus? Is complications. Yeah. It's severity. Guys, social distancing isn't to stop you from getting the virus.
That's right.
Everyone's going to get it, okay? Everyone's going to get it. But the reason why we're trying to flatten the curve is because we don't want to stress out our hospital system. We don't want to stress out doctors. We don't want to stress out nurses, right? So the whole point of flattening the curve is that there aren't too many people that are severely sick at the same time that they end up in the hospital.
Yeah, it's so true.
Social distancing isn't the only way we do that. I just said that article after article talks about how vitamin C decreases the severity. And I'm not talking about emergency, guys, not this little packet. You know, we did a whole video on vitamin C and vitamin D. If you can find us on YouTube, we at Doctors Warren, DRSWARRE, and you can see the vitamin C, vitamin D video there. It's also on our Facebook page on Doctors Warren. But another way, you know how you flatten the curve is, AKA flattening the curve means how do we stop people from needing the medical system? How do we stop people from ending up in the hospital? You flatten it by decreasing people's severe reaction to this virus. And if vitamin C, listen, I'm not saying anything that we talk about is not going to be the cure. Like there's no studies to show there's a cure for this thing, even if they introduce vaccines, okay? There's no cure for it, okay? But we do know there are things that will decrease the severity, that will decrease your symptoms, and will decrease how long you've had it for, like vitamin C, like vitamin D, like astragalus, like monolaurin, like NAC. Again, guys, we have all of these resources for you guys if you're like, man, I want to know what supplements I can take, on our Facebook page at Doctors Warren and on our website. But what I want you guys to know is that we're not completely lost in all of this. You know, Dr. Nathan talked about this germ theory, this theory that like, what does it mean is that just because you're exposed to something doesn't mean you have to die from it. If germ theory were 100% true, then we would all be dead. There's be no humans because we're being exposed to infections, bacterial and viral every single day. So the purpose of today's show is to encourage each and every one of you guys that are listening to have hope, to take care of yourself, and to have freedom over fear. So we have to go on a break here, guys. If this is the Wellness Radio. Find us on Facebook at Doctors Warren, and we'll be back right after the break.
All right, guys. So one of the things that I wanted to go over here. That's all right. Yeah. One of the things I wanted to go over here. I'm super excited you guys are joining us live. Mallory, good morning. make sure as we go through this show today, because it's going to be a lot of fun, I want you guys to ask your questions, leave your comments, and again, we're going to ask you guys, even more so than ever, I want you guys to share this information. You got to share this information. We have to get this information out there, because one of the biggest things that Dr. Rebecca and I, want to do is, number one, we want to give information, but we also want to bring hope. But also too, we want to spread a message that involves, protecting our freedoms here in the United States of America. Last time I checked, again, we are literally a nation built upon freedoms. And in this moment, today, right, across the United States, we are seeing these freedoms not only called into question, we are seeing them absolutely 100% violated. And here's the crazy thing about it, is that a lot of citizens are gladly giving those freedoms up, right? For something that they don't even fully understand. Listen, if you are just getting your information about COVID-19 or about the immune system from CNN, from all of these different news outlets, Wall Street Journal, whatever it is, guys, if you're getting it from mainstream media, you are missing out on real information, and you are making decisions that can and absolutely will be detrimental to the way that our society looks, not only going forward in the next 6 months, but again, going forward in the next 5, 10, 15, 20 years. And so really when you're looking at, what's going on here, we have to be aware of the severity of the situation. And what I mean by that is the severity of what we're doing with shutting down our entire society for something like COVID-19. I had several patients that came in this week, and they're like, Dr. Nathan, they're like, I just don't get it. I was looking and I was reading stats on, past major plagues, and like the Black Plague and the bubonic plague, and even things like the Spanish flu from 1918. And they're like, we're looking at these numbers, and then we're looking at what we're dealing with right now, and it literally makes no sense. Guys, we are in an absolute panic mode, which is now driving the decisions and the policies that are being made. One of my biggest pet peeves on the planet is we actually have right now, even in Chattanooga, and across the United States, we have people that are telling, churches, and again, religious areas of the United States to stay, not only stay away, but they're threatening them with jail. They're threatening them with, misdemeanor charges. Guys, this is not okay. It is not okay. It is completely backwards for what this country is supposed to stand for.
And but this is the biggest thing that we have to understand is like, we're making a lot of serious, we want to be safe. We want to understand how do we not, allow people with high risk to end up in the hospital. But we are using statistics, we're using research, we're using numbers that are so inaccurate. I mean,
Completely.
The death rate was at 3.2%, and then just 2 weeks ago, they're like, oh, my bad, it's 0.66%. So we have to understand what we're doing and how to best prepare.
All right, guys, welcome back to Wellness Radio. I am your health expert, Dr. Nathan Warren, and I'm here with my beautiful wife, Dr. Rebecca Warren, and we are bringing you a show today that's going to be full of, yes, answers, yes, information, yes, hope, but also a little bit of fire today too. I think that one of the reasons that we've really gotten some great response from our radio shows, because when we first started this, we made a pact. We said, we're going to talk about the truth regardless of what's going on. We said, we're gonna present it from a way that's not just portrayed in our media, but we're gonna present it in a way that's supported by not only research but also supported by logic. I think that's one of the things that gets dropped quite a bit, is that in our world we think everything has to come from the educated brain, and actually as much as I want to do that, and as much as we're going to do that, we're also going to talk about logic and wisdom as well too. It goes a long way.
So one of the biggest reasons we want to share about this is because stress and survival response, mental wellness, right now, most of the people I'm coaching, that's what we're working towards. Like right now, we have to start to prepare about what this means for us, for our economy, for our community in regards to health. in regards to how this is going to set you up here in the next few years. And so the biggest thing, if you're listening to this right now, we want you to understand is that you've got to understand what's going on. If you're reading the headlines, it's going to be overwhelming. So like I talked to Dr. Nathan today. You know, Sweden is taking a different approach than a lot of countries. Sweden is looking to just not do strict like restrictions. Like they're not making people stay home. They're trying to do things through herd immunity, which is really interesting because everyone talks about herd immunity when it comes to vaccines, but not when it comes to this. But that's a whole nother topic. But so I started seeing, when I first saw the article about Sweden, it said, okay, so Sweden's going to try to, not lock down their entire country, but they're going to try to work with the people to be safe, to distance themselves, but they're not going to restrict it. And then yesterday I looked up again and all the headlines were negative. Oh, this thing isn't working out for Sweden. Oh, this isn't good. And oh, they're doing so bad. But most people, all they do is read the headlines. You click share on Facebook and that's all you do. I mean, I'm not going to lie. I do that for the silly stuff. But like for the serious stuff, I'm not going to share it unless I've read through it. So I read the article, then I clicked on the link. So the article says, Sweden is doing this, but it might not be working for them maybe, okay? But everyone's sharing that it's not working, that people, So when I went to the study that they referenced, and most people don't do that. No one looks at the stats. No one's looking at what do the numbers mean, When you go and you look at it, first of all, the study admits that they have limited data. So you're declaring, these media, headlines are declaring something that they have incomplete information on, right? But the article says, we don't have complete data, but we're just going to go ahead and assume, and we think our assumption is going to be well. So what they're saying is that right now in Sweden, it's a 3% death rate. But the problem is, if you're comparing only to the people that are being tested, then you do not have an accurate number pool of patients, okay? What does that mean? The same thing here. I mean, you guys have heard this. I've heard people in my office say this. I've heard people here on Facebook. I've heard people say, man, I felt like I was really not well in February, or I felt like I had something in January that wouldn't go away. But this is the problem. If we're only testing, and we all know, we've heard the stories, some people try to go to the doctor and get tested and they wouldn't test it, and we just had limited testing. But if we're only testing severe people, meaning we're not testing the people that are positive and are mild, if all we have to compare who's dying is the people that are really, really sick, well, you have a small population number, and that small number versus this higher-ish number of people dying, well, you're going to get high percentage. I hope that makes sense because people are not understanding this. So if I say, I've heard, other states, they're handling better, or these states that are shutting down, they have better numbers. Yeah, well, when Tennessee is testing 32,000 people versus, Kentucky that's tested 8,000, guess what? We're going to have more positive cases and probably more deaths related to it. So I want you to understand, guys, I read this somewhere, and when your body is not well, any virus will do.
Yeah. Okay,
if you are not well, it doesn't just have to be, not even virus, any infection will do. Any bacterial infection, any viral systemic infection. So what I want you to understand is that what it comes down to, first of all, those headlines that are freaking you guys out aren't even correct. You don't realize it, that when you have the news on in the background, or you're seeing a headline, or you're sharing, or somebody, can I tell you, listen, if you're doing this, you need to stinking stop. My friend's neighbor's cousin saw a healthy person in the you don't know the personal you don't know the personal status of someone. You don't know what they're struggling with. And I've said this every weekend. I have women that sit in my office, beautiful, smiling women, that when I get through to them and they know that I understand what they're going through, they break down and start crying and tell me how no one knows how unwell they are from the inside. If you're on thyroid medication and you have an autoimmune issue, your immune system is not well. If you're on insulin, metformin, your body is not well. If you're on blood pressure medication, your body is not optimal. Yeah. So Yeah.
I mean, isn't that the problem though? The problem is just like you said, it's the definition of health. Here in America, our definition of health is saying, oh, wait a second, you got high blood pressure, but you're taking your blood pressure pill, so therefore you're still healthy. You're a healthy individual. You're a healthy 54-year-old. Oh, you know what? You've got high cholesterol and everything, but you're on a statin, therefore you're healthy. You're a healthy individual. Our definition of health in America is absolutely 100% wrong. It is basing your health off of symptoms. So therefore, if we can cover up symptoms, you're a healthy individual. I mean, I'm seeing it more than ever right now in our office because I have pain patients coming in that up until this last Tuesday were still coming in with prescriptions written by their stinking doctors for steroids that can shut down your immune system when in a time that they need their immune system the most. And it absolutely blew my mind. Why? Because the definition of health in America is that if your symptoms are being covered up, you are a healthy individual, and that is wrong. And it's time that we change the way that we look at it, because if we don't, are we going to do this for the rest of our lives? Is this what we're going to do? Are we made to say, oh my God, viruses every single time they come around, oh man, we got to go into our house and we got to hide. Oh my goodness, we've got to make sure that we are telling on other people. Guys, holy cow, don't be that person. I mean, oh my, that's like Nazi Germany. We cannot be telling on people because they're, going outside of their house and they're sitting in the stinking sunshine. I saw somebody downtown the other day that they were sitting in their apartment and they're wearing freaking N95 masks. And I'm like, you're part of this stinking problem. You don't understand the immune system and what's going on. And now we're looking at a medical system that has to get their masks from all kinds of places and, homemade masks and all of these things. Guys, bottom line is our definition for health is wrong. Health is not how you feel. Health is not how you look. Health is how you function, period. That's it.
And so another thing I want to touch on too is this. So the reason why this is a really big deal for me, that you guys understand that you have to take care of your health. Like, I mean, I don't know how many more times we can tell you guys this every Saturday. We just want you to know that you are able to influence how your body reacts to its environment. But this is another thing I want to point out. There's a lot of people, if you have comorbidities, if you have issues going on, be super cautious, stay home, like for real. Like if you're on these medications, if this is who we're talking about, listen, the only thing I would say is what we can do, you can stay home, get a consult with us. We do virtual consults and we'll help coach you through this. But I want to point something out because I'm seeing a lot of people wearing face masks. I'm seeing a lot of people wearing like t-shirts and stuff like that. And I just want you guys to know that, yes, something is better than nothing, I suppose, you could stay like 6 feet away. But I know there's a lot of places you go to where there's a lot of people. But let me talk to you guys about false security, okay? Let's talk about false security because there's a lot of you guys going out and thinking that if you wear this, then you're fine. What I'm saying is if you're going to wear it, but take care of your body, the vitamin C, the vitamin D, the nutrition, getting off of sugar, those types of things. Okay, guys? So, the CDC just said this past week that, everyone should go out and wear masks. So right after the CDC said that, World Health Organization, said and reported, like worldwide, who says there's no need for healthy people to wear face masks days after the CDC told all Americans to cover their faces. But let me go ahead and share some information with you guys. There are studies done on will these face masks protect you. So there's a 2015 study found that cloth masks only blocked 3% of particles compared to medical masks, which are 56% of particles, and the N95 ones that are 99.9% of particles. Okay, so a 2015 study found that cloth masks only block 3%, right? A 2013 study found that cloth masks made from cotton t-shirts, pillowcases, or tea towels should be used only as a last resort. Guys, that's a really big deal. Walking around with a face mask with a body that's not well is still putting you in danger. So when we get back, guys, we're going to talk some more about this. If you're tuning in, we're Dr. Warren. We have a clinic here in Hamilton Place, located right across from the YMCA next to the Home Depot. We have virtual health consults. And we'll say this again, for the whole month of April, we're doing a special pricing for appointments, either virtual consults or in office. Instead of between 120 and 150, it's just 45 for you guys to come in. This is the Wellness Radio. If you would like to make an appointment, the number is 423-362-5360. We'll see you guys right after the break.
All right, guys. So here's the thing. I wanted to read because we've had some really good comments here. Nancy, good to see you on here. I love to see you on here. But yeah, she said, people rarely read the full article. It's about the headline. No one wants to admit that they aren't quote unquote healthy. They want the appearance of healthy. Man, that is so true. That's what we're talking about. Like, people just want to say, you know what, I look like I'm healthy because I'm covering up my symptoms, rather than looking at how well they function. And this is a fundamental flaw. This is why we're in the situation that we're in right now. And then Pat said, some physicians like to mask your problem and give you medications that think you're healthy. We have to be protective about our treatment. Yeah, I mean, again, that's so true. It is the number one thing that we see as a fundamental flaw with our healthcare system today. And we call it a sick care system because that's really what it is. And again, it's a system that was based off of, dealing with the germ theory, which we're going to be diving into here in just a minute. It's a whole system based off of, dealing with infectious disease based on the germ theory. It's not a system based on how to deal with chronic disease. And so really what we've done over the past, 100 years is we thought we kind of made this whole illusion that we've traded, infectious disease for chronic disease. Listen to this, guys. We have 54% of kids under the age of 15 have a chronic health disease. 54% of our kids under 15 in the United States have a chronic health disease. 1 in 36 of our kids have autism. We know that, again, 1 in every 3 of our children has an issue with chronic allergies and sinus issues. We know that asthma is 1 in every 6. It's the most common childhood chronic disease that we have in the United States. And yet, again, we are in this situation because of that. Yes, I know we're talking about an infectious disease, but bottom line is this. Your internal health is the determining factor of how well you will deal with your external environment. And so again, if we're not dealing with our internal terrain, you can succumb, again, in a more easy fashion to something like COVID-19 or any virus or any bacterial infection that's out there. It's about your internal terrain.
So this is a good one. Having a physician you trust tell you you're fine when you're clear and if you're not is just so disheartening and frustrating. So glad I found you guys while I'm young enough to make changes.
Yeah, it's awesome.
So glad you said that, Alexis. Yeah. I spoke with someone a couple weeks ago and they listened to a radio show when we talked about my birth. And they were like, wow, when you said that I'm hiring someone for their expertise, their background, and their experience, that you can fire a doctor and hire a doctor that's more aligned with your goals. She was like, I just never thought about it that way. And you're absolutely right, Alexis. Like, it's so important. I'm so glad you're with us and I'm working with you. Thank you for that message. But yeah, like, if we aren't going to the right people, then we're putting ourselves in a very dangerous place. Like, I was that way too when I was 21. I had my thyroid cancer. They cut out my thyroid. They told me that everything was fine, even though I didn't feel fine. Like, I felt horrible and I couldn't lose weight and I just felt overwhelmed and I was depressed and I was anxious. But I would go to my doctor and I would get lab work done and they told me that everything looked fine. Guys, we're getting a message pop up. It's we can't see. That's why we keep touching our phone.
Maybe that
got rid of it. Anyways, so it's so important to understand that having the right team behind you, the right physician behind you that's listening to you, that's going to help you get down to the cause is so vitally important. And if you don't have a physician that does that, then fire them and make an appointment with us. We're Dr. Warren on drswarren.com. So we're about to go live again here.
All right. Yeah, and again, make sure, guys, as we're going live on the radio, we love for you guys, leave your comments. Sonia, thank you so much for saying that. Make sure you leave your questions. If you have specific questions on COVID-19 or anything else, leave your questions. We'll answer them for you guys.
Hey guys, this is the Wellness Radio. It's Doctors Warren here, Dr. Rebecca and Dr. Nathan Warren. You can find us here on Facebook. We're live right now. Check out more information about us at doctorswarren.com and on YouTube, which is really exciting. Most of our videos, and we're going to get all of our radio shows on there, so you can find us on Doctors Warren. Subscribe and like or do whatever people do on YouTube. Guys, our office is located in Chattanooga, Tennessee. We are...
But our virtual practice
is everywhere.
It's everywhere.
So we have a clinic. We are considered an essential health business because we're, essential, obviously. But our clinic is located right across from the YMCA next to the Home Depot. And so we are doing off-hours, one-on-one appointments. So if you're in Chattanooga and you really need a practitioner, you're not feeling well, or you're nervous, or you're scared, or you're anxious, whatever it may be, this is kind of, our first appointments are usually just meeting you where you're at, seeing what you have going on, and helping you out. We have that clinic here in Chattanooga, and then virtually, all over the U.S., guys. And of course, this next month with everything that's going on, we are discounting that. So you can call us at any time to book your appointment with our girls at the office. It's usually between 120, 150, depending on in-office or virtual, or it's just going to be 45. That's just what we're doing for our followers, for our community. Headaches, back pain, car accidents. We're getting a lot of people that have been in car accidents, or if you got thyroid stuff, if you got hormone stuff. Our phone number, so you guys know, it's 423-362-5360. Again, that's 423-362-5360. And of course, you can find more information about us at doctorswarren.com. And so what we've been talking about this whole entire time, right before the break, I talked about studies that found that walking around with a homemade mask may only protect 3% of, may only filter out 3% of the particles that you're being exposed to. And that another article in 2013 found that homemade masks should be your absolute last resort. Now, am I saying don't go out and wear a mask? Listen, the CDC is saying go out and do it. You want to do it, do it. But what I'm saying is that if you're depending on that mask to protect you, it might not.
It's a false sense of protection.
Yeah, it's a false sense of security. But what I'm saying is wear the mask, but don't go home, eat Cheetos and frozen food and stuff in your pantry that just wrecks your health. Wear the mask, but eat foods that are healing and nourishing, that are going to help you be strong. Wear the mask and take your vitamin C, not emergency, like liposomal or designs for how buffered vitamin C. Wear the mask and work out. Wear the mask and get outside. Don't depend on this outside thing. The only thing that we know from the numbers, at least, and what's being reported, is that the best way to stop your chances of ending up in the hospital is how your internal environment is functioning. And listen, this is what I want to say too. I want to say this last thing here. We preach this over and over and over again. We talk about how you have to do something for your health before it's too late. Now, with this pandemic, a lot of people are realizing this is late. They're kind of in survival mode now. But for you guys that feel like you're okay, if you're not taking care of your health, this is a wake-up call. I talk to people when they come into the office about how when you have symptoms, they mean something. And I had someone that I spoke to back in January with severe health issues, and I spoke to her about what those health issues mean, only to have her call me and tell me she's been diagnosed with cancer. And now, instead of being in a preventative state, we're in a 911, let's take this down state. You don't want to end up in a situation where you're surviving and you're fighting for your life. You want to be thriving every single day.
No doubt. Yeah. I mean, again, you are in charge of your health, period. Nobody else. You are, and that's it. I wanted to touch on one more thing too, because you were talking about the mask. Can I just say this, and again, actually I can, because it's my radio show. Stop taking pictures on Instagram and Facebook of you with your mask on. The reason I say that is because it drives me nuts, because we are making that a norm. The more that you do that, the more that we say, you know what, this is just a normal thing. The more that we get used to that, the more that this is something that we then adopt later on, as again a false security blanket, like it's something that we should be proud of. I'll tell you this right now, I don't want any part of that. So let's stop making this a norm. Now, again, and Dr. Becky touched on this earlier, with social distancing, people have adopted the idea that social distancing is a way of getting rid of the virus, right? It's not. That's not the whole point of doing social distancing. So again, don't be one of those people that again are saying things like, like social distancing at all costs, because again, there's other plans out there that were, presented, but we didn't follow through with those by people like biological engineers from MIT, from places that are some of the most brilliant people in the world that actually had plans that said, hey, you know what? There's ways that we can not shut down our society and yet still protect people who need protecting. So to think that this is the only possible way that we can go about this is absolutely false. And again, we want to make sure that people understand that. Not that you shouldn't follow guidelines. I'm not saying that. Follow the guidelines.
Guys.
We've said that many times, but don't accept this as a norm. Please don't accept this as a norm. Right now, I don't know if you guys know this, I'm sure you do. We literally have, governors and senators and people like that across the country that are really starting to violate, religious freedoms. They're really starting to violate, some of these freedoms that this entire country was based around. And I would say this here, it's never really been a political radio show, but bottom line is, what, we're here to talk about the truth, and the truth is that's not okay. I'm not okay with that. You shouldn't be okay with that. You should not be okay with, things like pastors, like we had a local pastor here in Chattanooga that's literally filming something for Sunday for Easter. Again, everybody's spread out. They don't have anybody, no crowd, nothing like that going on. And they get harassed by our own Chattanooga Police Department. Absolutely insanity. We are going and crossing a line that never should be crossed, period. And again, as soon as we are okay with sacrificing those freedoms, we have now lost what this country stands upon. And again, I will not stand by, and stand with that type of attitude. I know you won't. And so again, I hope that you guys that are listening to this will not stand by and be okay with that type of crap that's going on. Because, you look at it and say, well, you know what? You can pack 200 people into Home Depot, or you know what? A liquor store is going to be considered essential, or a laundromat is considered essential.
Man.
But
we have people that work
nuts.
in our local factories like Amazon or like McKee, and they're stressed out because they're like, everyone is saying like, oh, stay away, stay home, don't even go outside, let's close down the bridge, let's do all these things. And here are hundreds of people that are literally, if you see us on our Facebook, like we're sitting that are literally right next to each other, right across from each other, and there's hundreds of people. And so, the truth is, if we want to stop that spread, we'd probably shut down all the factories and all these things, but we can't do that, So what we're saying here, guys, is that one thing I've noticed is that you have to start thinking critically. And man, I'm loving all the comments we're getting on our Facebook live video. You guys can watch us on Doctors Warren. I love it because people are starting to realize, oh my gosh, something's not right. Like things aren't clicking, things aren't okay. And what we're asking is do everything that's recommended. Follow the rules, okay? Right now, be safe. Although, let me go ahead and tell you, if it's losing your mental sanity or going outside for a hike, go for a freaking hike. Make sure you're just not around anyone. And if there's a ton of people, just leave. But what we're saying is, guys, think critically. Let's challenge ourselves and think, okay, we have to do these things right now because it's legal. Our mayor's asking, our governor's asking. But start thinking about ways that you can be different from the status quo. Think about ways that you can start protecting yourself. And that's what we're going to continue talking about, guys. We're here for you. If you'd like an appointment with us, our number is 423-362-5360.
Wherever you're at.
Wherever you're at, virtual or in office, usually up to 150. It's just 45. This is the Wellness Radio. We'll see you right after the break.
All right, guys, so we've been talking a lot. We're getting a little fire, a little hope. Let's go over some information here, because one of the things I wanted to talk about today is the difference. Is the germ theory the only theory out there? And yes, remember, most people don't even know that it's called the germ theory. They don't even recognize, they may say germ theory, but they don't really recognize that it is a theory, which means that yes, A man came up with this idea, and we're talking about well over 100 years ago, and we adopted it as truth. And then again, this quote unquote truth became dogma, and now it's taught in medical schools. It's taught really across the board, even to your children, as that this is an absolute fact, that this is the only way that there is the germ theory. And is that correct? I want to dive into that.
So let me go ahead and, because we've got to understand this. You're saying theory a lot, right?
Yeah. Mm-hmm.
So let's go ahead and talk about scientifically, what does it mean if something's a theory? In the context of science, a theory is a well-established explanation. But what does well-established explanation mean? It means theories typically not proven, they haven't been proven, but they become established because they just keep on being used by different scientific communities. It's different, they are tested by several different scientific investigators. So it's not something that's proven. So, kind of like the serotonin theory in depression, just like the germ theory. And so the one thing that's really crazy about the germ theory is that if it were true, it's pretty much that your exposure, like your sickness, your illness comes from your exposure to that outside factor.
Disease arises with outside, germs. Really, it's an outside in, type of approach. It's saying that literally, the germ theory is that microorganisms are bad and are out to kill you. That's literally what the germ theory says. That, your viruses, bacteria, all of these microorganisms, again, they're out to kill you. That is just what they're designed to do. Their whole idea is that, and I've got like a list of differences
so
here.
Let's do this. Listen, he's got a study here. This is what it's like to be doctors with a toddler. And this is what our toddler did. I'm like, how are you reading that? Okay, so there you go.
I love it. Oh yeah. So here's some differences here. So germ theory says that diseases arise from germs outside of the body. It says that microbes are generally to be guarded against. So that means we should always be on guard with the germs. They say that every disease, listen to this, every disease is associated with particular microorganism. So that means every disease that we deal with is related to a microorganism. It says that microorganisms are a primary cause of disease. They're a primary agent of disease. And so guess what, guys? This is not the only theory, but yet we have a whole system that's based around this thought that, again, all of our outside world is out to kill us all the time. That again, your internal environment does not matter. That again, it's an outside in approach. So guess what? When you adopt something like the germ theory, if disease is coming from the outside in, guess where the solution comes from? The outside in, right? And so that is why when we look at what is our medical system used to deal with the germ theory, it's what? It's an outside in approach. Medicine and surgery, right? Medicine, surgery, and I guess you throw in vaccinations with that too. So again, those three things right there are an outside-in approach because they recognize disease as coming from the outside affecting the inside. But like I said, this is not the only theory that's out there. There's also something called the terrain theory. And the terrain theory says that disease arises from germs, sometimes within and sometimes without, the cells of the body. So I know we got to go live here, so it's kind of an interesting transition, but we're going to keep talking about this.
We'll come back.
Oh, it's not ready yet.
10 seconds.
Yeah, 10 seconds here. So again, difference between germ theory, terrain theory. That's what we're going over right now.
All right. Not ready yet. Welcome back, guys. This is the Wellness Radio. Dr. Rebecca Warren here with Dr. Nathan Warren. We are Doctors Warren. You can find us on Facebook at Doctors Warren, doctorswarren.com, Doctors Warren on YouTube. Really, if you want us to know for anywhere, just look up Doctors Warren. That's where we show up. But we have a clinic in Chattanooga, here in Chattanooga, located in Hamilton Place, right across from the YMCA next to the Home Depot. And we have virtual consults all over. Monday, I think I had like 10, and people love it because you're in your jammies. And just so you guys know,
wait, you were in your jammies?
I was not in my jammies. I get myself together for you guys. Right? But we are a resource for you guys here. We want to create all the tools you need to not be afraid to have freedom over fear, and how to protect yourself, how to be well. Because right now, you just went on Facebook and heard from your brother's, sister's, cousin's neighbor who's a nurse at the town's hospital that they saw a completely healthy person die, okay? Or you heard that like your sister spoke with her neighbor and her neighbor's whole entire family died. Like you're hearing all these things, you're seeing all these mortality rates, you're seeing all this negative stuff. And the thing you don't understand is that even if you don't realize it, if this information is surrounding you, even if you don't focus on it, the fact that you see it, the fact that you hear it, internally, your body's already reacting in a sympathetic survival state. You're having a response. Yeah,
no doubt. And again, at what point, like, this is another thing that drives me up the wall. I'll read every now and then like a nurse's account of like a dying COVID-19 patient, or a doctor's account of it, describing this whole scene and everything for a specific media site. And, at what point do you need to describe that when that's what you signed up to do? When you became a nurse and a medical doctor, your whole point was to help sick people. That means that you have signed up to be there at the end of life every single time, right? Yeah. So again, it's not something that needs to be, dramatized and
hard.
Things like that.
It's hard. We know that people are dying. We know this is a serious thing. But there's something that you point out that is just really interesting to me, is that ancestrally, we had a tight-knit community where we knew the people that passed away. We were involved in the process, and we could mourn and grieve from it. We're living at a time in social media that we're bombarded with death, like information and facts.
There's a countdown clock.
Yeah, pretty much. Yeah, like you Google it, like how many coronavirus, you're seeing a number of people dying. We're being exposed to information at rates that we shouldn't have. And if you believe that doesn't have an effect on you, it does. It is wearing you down, these stories, and you hear them. And you're really good at this. I have to get better at this, to shut it off and protect your mindset. This can be a serious thing, especially if you have other risk factors. But you have to shut it off, and you have to say, hey, I'm not going to live in fear. I have to do things for my health. I have to take care of myself. I got to make sure that my immune system is well. And let me go into one thing that really pisses me off is there's these articles that are popping up that you can't boost your immune system. You can't do this. I said at the beginning of the show that vitamin C has been shown to do some amazing things like fight cancer. And even they're using it in China. They're using it in other countries, right? But then I look up articles here and it's all negative. Vitamin C won't cure coronavirus. Well, no, duh. Nothing that we talk about, we're telling you is going to cure it.
There's nothing, though, that it's going to cure it. Medicine does not cure it. A vaccine does not cure it. Again, there's only one thing that ever inactivates a virus or kills bacteria, and it's your immune system, right? Even it doesn't matter if it's the best medication in the world, guys. If you think that medicine cures anything, you're missing the point. Can medicine bring somebody back from the brink of death? No doubt about it. But bottom line is it's not curing anything. It's your immune system that does that.
So here in the second hour, guys, we're going to talk about what you've got to do. You can tune in here on the radio show or go to Facebook, Doctors Warren. We're going to talk about some real tools to start implementing every day right now, especially if you're on lockdown.
Yeah. No doubt, guys. All right, guys, so we'll see you in the next hour. This has been Wellness Radio. See you right after the break. Wellness Radio is presented. All right, guys. So, you guys are on Facebook, so we get to keep going, which is super exciting.
Yeah, so I know we wrote the terrain theory. This is because it's really funny, even like chiropractors are people that should... chiropractic is, I love, no matter what I end up doing in my life, whenever I retire, even though I'll move to like Sweden and live in the mountains, I'm still going to be at the core.
Does Sweden have mountains?
I don't know. Or Spain.
I think Switzerland does.
That's what I bet. The Swiss Alps, okay?
Maybe Sweden does.
When I retire and you take me out into the woods to get away from everything because you're so tired of the world, I'm still going to be a chiropractor to my core. And in my profession, and even when I do functional wellness stuff, it always goes down to the principle that the body's created to heal. And there's 33 principles in chiropractic, and they're stinking amazing, and they're showing up in science now. Yeah. But the body's created to heal, and healing comes from the inside out. And it's sad that there's even some doctors of chiropractic that don't even understand.
Yeah.
Like they think that it's just germs, that they can joke around, oh, it's just a germ theory. When we have people dying, hundreds and thousands of people dying from preventable illnesses and diseases. And so understanding this, I feel, is so powerful. And if you understand this, honestly, you know more than a lot of doctors out there. So
probably 98% of doctors out there.
Yeah.
So he said the germ theory is disease arises from germs outside of the body, right? That microorganisms are all out to kill you. Whereas when we're looking at the terrain theory says that disease arises from germs within the cell of the body. So that means how your cells and how your immune system work determines the rate of disease and how you deal with that quote unquote disease. The other things that you have to realize too is when we're looking at the terrain theory, compared to the germ theory says that microbes are generally to be guarded against. Whereas the terrain theory says that these microorganisms, right, normally function, right, to build and assist in metabolic processes of the body. Now, here's where it gets really, really good because science supports this part. You know why I know that? All the new research coming out over the last 5 to 10, even really close to 15 years on the microbiome and how bacteria and viral RNA and even things like parasites, that they can actually work in a symbiotic relationship to help and aid your immune system, right? And being able to, again, deal with outside sources of microorganisms that are coming in. So that means that your body is designed to work together. Symbiotic relationship.
Something too, we do some amazing stool testing and gut healing, and it's really hard to use those stool test results because we know for a fact that if you have really, really bad like H. pylori, you can have parasites that will take in some of your toxic burden. Like we know that parasites can hold up to 2 to 3 times its weight in heavy metals. So that parasite is existing, this parasitic infection is existing not to kill you, but to help you survive.
Yeah, that's right.
I mean, we're injecting measles virus into people that have blood cancer because they're saying, oh my gosh, this virus can actually work with the immune system. I mean, I have people that have underlying infections and then they get sick. Like 3 days, they get really, really sick. And after 3 days, it's like there's mental clarity. They have no longer fatigue. Like
autoimmune issues, skin, right? When kids start to, when I'm coaching kids, right? When I'm working with their parents, with autoimmune conditions like skin issues specifically, it's so amazing how you can actually see, they're like, the only time I actually see their skin clear up is when they have a fever or when they have an immune response, their skin starts to clear up and they don't understand the mechanism why, but in reality, it's because their immune system is training. It's because they're in an autoimmune state, which means they are stuck in what's called the humoral part of the immune system, which is the memory immune system. So they develop so many different mature memory cells or B cells that, again, are really now targeting and actually hitting their body and creating an autoimmune response. So when they get a cell-mediated response or a fever, right, or a T cell response, guess what happens? It actually trains the immune system and some of their symptoms start to go away during that time. So again, it's showing you right there that your immune system's powerful, but we also know there's certain things that have directly affected your immune system to either create a hyperactive immune system, like in the case of autoimmunity, or again, a compromised immune system in the case of, again, so many people with things like comorbidities and chronic disease.
Yeah, absolutely. And so it's just really important to understand. And this is the thing. And we talk about this all the time. Okay, so when we're telling you do our viral protocol, which we have a viral protocol, guys, if you want to say no to that. Yeah. We do have a viral protocol, so if you want that, make sure to message us here on Facebook or leave a comment that you would like our viral protocol. All the supplements we're taking, all the supplements we're selling to our practice members, people that we're coaching, that is research-based to help fight viral infections. But the really interesting thing to understand is that, okay, you know, all these doctors are like, there's no way to, you know, boost your immune system. But the problem is, and I want you to think about it differently. You're not taking these supplements, you're not changing your lifestyle to boost anything in particular. You are changing your lifestyle. You're taking the supplement to rebalance your body, because what you don't realize is this chronically sick, toxic world we live in is knocking us in balance, okay? So what that means is, like, I had a conversation with someone I was coaching right now. I was like, a lot of you guys that are taking vitamin C aren't taking the right type and also aren't taking enough. So when cortisol is out of control, which work stress, family stress, you got into a car accident, reading media and all these things, your cortisol goes up and it depletes your vitamin C. So when we tell you, hey, take vitamin C, it's gonna help your immune system, we're saying that because you're depleted, not because, hey, use this one thing and this one thing is gonna help your immune system. Vitamin D is an amazing supplement, but why? Is it because vitamin D is this really magic pill for the immune system? No, it's because you're not going outside.
It's because we're disconnected from nature, right?
Because our liver is toxic. You take these supplements because we're missing, because we're imbalanced and we're trying to make up for this toxic world that we're living in.
No doubt. That's a perfect example. Again, we're looking at why do we have to even supplement with vitamin D? It's because we're not, like you said, we're stuck inside all the time. We're not getting outside. We're not getting that conversion of vitamin D3. The other part of it is even some of you that are getting outside, again, if you have any issues with the liver or any issues with a compromised gut, you also have to know that your conversion to a usable form of vitamin D3 in the body, again, is not going to be optimal. And so that's why we can see people that do still get quite a bit of sun, and yet they're still having issues with being able to convert it, right? With being able to actually convert vitamin D3. And so their numbers are still super, super small, which is a big deal. You know, there's other ones out there as well too. So when we're looking at your diet, what you consume, what you eat, when we're looking at the water that we drink, there's so many different things that we're completely disconnected from the way it meant. But it all matters completely when it comes to our health. Do you have something you want to say?
No, I wasn't sure if we were live, guys. Sorry. Like, we're live here on the radio.
This is Scott Gallo.
Oh, okay, there's a commercial. Okay, I was going to say this. I'm really excited. We didn't mention this before, and people were like in and out. But this next week, we're going to do a video series every single day. We're going to talk about the free ways, the free things you can do that will boost your immune system. But remember, when I say boost your immune system, is help rebalance your body to support your body's healing process. All right, so we are going live now.
It's not easy going from radio to computer to at home.
We're so talented.
Yeah. They're doing our intro here. So, you know, again, guys, I hope please, yeah, well, it might be live. I don't know. Leave your questions.
They can hear us talking to you guys. The call letters.
I don't know if that is.
All right, here you go.
All right, guys, welcome back to Wellness Radio. I'm your health expert, Dr. Nathan Warren. I'm here with my beautiful wife, Dr. Rebecca Warren, for hour number 2 of Wellness Radio. And so if you were with us in the first hour, again, we brought a lot of, some information, but it was really a lot of fire and a lot of, kind of talking about what we want.
The first hour was you just needed to get stuck with frustration.
I had to. I mean, because I'm so sick of this madness of how we've dealt with this process. I'm absolutely 100% disappointed in us literally eliminating the freedoms that this country was founded upon. I am not okay with that by any means. And again, that's thinking that the way that we went about it is the only solution is absolutely false. Again, there were other solutions that are out there, and I don't know about you, but again, I want to make sure that this doesn't happen again, right? That we're not for the rest of our lives, and that our kids are not taught that the rest of their lives, that every single time there comes a, whether it's the seasonal flu or whether it's, COVID-19, it's, whether it's seasonal or it's not, or it's another virus, that the only solution is to run and hide for the rest of your life.
Yeah.
Like, it's wild.
And so I want to say this, and I said this in the first hour, because we're going to talk about some solutions and things that you can start doing today. You guys don't realize that resharing these negative articles, and I'm talking about negative, this person died, this young kid died, this is how many people are in the hospital, this is resharing that, freaking out over every single cough and sneeze, turning on the news, talking about this, freaking out. Like, you guys don't understand internally what you're doing to yourself, to your sympathetic survival response. Stress is stress is stress. When your body's being chased by a tiger, it's going to freak the crap out, and your body thinking negative thoughts, like stressing out, being anxious about things, it's the same thing as if you're being chased by a tiger. So we have the studies on it. We'll share it this week on our Facebook page at Doctors Warren. But you guys have to understand that protecting your mind and being mentally well matters. Turning the news off. We know it's a serious issue. We know there are people that are dying. You don't need to be bombarded by that message. And I shared something which is really interesting. I share pictures and memes on our page sometimes, like good ones. And one picture, I think it might be the most shared picture that I've shared on our page so far. And it talks about social distancing, which is physical distancing. You guys should still keep your social connections with your friends and loved ones. But it says you can social distance online as well. Unfriend, quiet down, unfollow. You can still be friends with them and unfollow. I know that because I had to unfollow a lot of you guys, friends of mine on Facebook. I unfollowed a lot of you guys. You can get rid of those negative things so that you can protect your mind and focus on healing and focus on supporting your body.
We got to, man. We got to. You have to. It's the one thing. Stress is the one thing that will literally inflame all other disease processes in the body. It will inflame it. Now, there's a difference between both good stress and bad stress, right? So let me give you a perfect example, right? Exercise is a form of stress, but it's a good stress because it ends up producing a great result, right? It produces a great result. Things like, hot cold therapy. So if you do something like hyperthermia, type training, which is like sauna, we do an infrared sauna at our house. That is a state of good stress. You actually build up what are called your heat shock proteins that make your cells more resistant, or resilient, not resistant, resilient. Same thing with, think about like just kids in general. If kids don't ever go through any type of stress, what do they become? They become a weak society. Maybe that's part of the problem.
I meant like weak immune system.
I'm saying a weak mindset.
Yeah.
Again, we have to go through certain types of stresses, and it produces resiliency. But there is a difference, like Dr. Rebecca said, from chronic stress. Chronic stress drives inflammatory processes and will absolutely drive any disease process going on inside of the body, no matter what it is. I don't care what autoimmune disease you tell me you have. I don't care what cancer, what heart disease, what type, diabetes, whatever it is, it will drive that process worse whenever we constantly have a chronic stress response. And again, it ends up affecting our cortisol levels, which throws our whole entire hormones out of balance and out of whack. And next thing you know, you're in your doctor's office with another prescription drug, again, relying on that to cover up your symptom.
Absolutely. And let me go ahead and tell you this. If you're doing Whole30, you've done keto the right way with organic food and good quality fat, you're doing paleo, you're working out, a lot of you guys that are actually making good health decisions, you're still going to get sick because you're stinking thinking. Like you're still going to get, I'm pretty sure old school chiropractor, I think he said that in his speech and I took it. But I mean, there's no doubt about it. We know that if someone has hope when they're diagnosed with cancer and they're told that they can live longer, they do. But those people that are taking their hope away and they're told they can only live an X amount of time, they found that not only do most of them die by that time, but they die earlier. Your mindset, your hope, all of that matters. And so I do want to say this, guys. Mary Beth let me know we had quite a few people call the first hour. If you guys want to set up a consult, let's talk about what we do, because you guys are like, man, you guys are just talking about everything. We are doctors of chiropractic and functional wellness practitioners. So we work with coaching. I mean, come and look at our comments here on our Facebook Live. I love a lot of our practice members really sharing their mindset right now, their thought process, and really thanking us. I'm thankful for the comments people are leaving us. But our whole point is to, you guys, Chattanooga, and even in your own state or city, you guys have enough. I tell this to every single person that comes into my office. You have enough people to treat your symptoms. Don't come into my office if you want to treat your symptoms. You have plenty of people that you can call. Don't set up a virtual consult with me if all you want to do is treat these symptoms that you're feeling. If you want to get down to the cause, why is my blood pressure imbalanced? Why do I have headaches? Like Chris that came in that was having headaches he came in during this crisis because he still has to work. He's considered essential, and he was having headaches so bad that he came in, and within the first consult and treatment, gone completely, getting his family checked. Okay, so what we do is we get down to the cause. So if my hormones are balanced, if my thyroid's off, if I want to prevent cancer, how do I do that? How did I get here, and how do I move forward? That's what that first consult looks like. And so we're doing consults in the office. If they're in person, they're one-on-one. You're not around anyone at all. We keep our distance, but we make sure that we're a resource for you guys. We have a lot of people coming in with pain. And what's really cool is we're seeing really great results with them really quickly because they're like, I want to get well now.
Relied on drugs for years, right?
It's really cool. It's really awesome to see. And we do virtual coaching. And so those appointments can go up to $150. For the whole month of April, we're only doing it for $45. So if you're listening to this, you want to make that appointment, you can give us a call at 423-362-5360. That's 423-362-5360. You can save that number in your phone. And you can find out more information about us at drswarren.com.
Yep. And so I think it's fun to kind of go into some of these things that you guys can do at home. We always try to give you guys action steps that you can take. We try to give you guys different solutions that you can do as far as taking care of your health now, while you're at home. One of the things that I talk to people about a lot of the time that I think goes, well under the radar is how you breathe, right? Your breath work. And so, this is something that you guys can all do right now, wherever you're sitting and throughout the day, is focus on some deep breathing. Again, I would even challenge you guys and say, when was the last time that you did some deep breathing? Now, some of you practice it, but I know for me, up until about maybe a year ago, I did not specifically practice, some deep breathing techniques. And we know that just by increasing your oxygen intake, making sure that you are really focusing your breathing, you can do things like lower your stress response. You can see your heart rate come down. You can see your blood pressure come down. Again, you are lowering your stress response. And how much does that cost? Oh, wait a second. It's free, right? It's something that you can do at home, and it's one of your most powerful tools that you can absolutely do on a regular basis is practice some deep breathing. So, pick a time. So it could be 4 seconds, 5 seconds, some people 6 or 7, depending on how big your lungs are, and taking that in, holding it for the same amount of time, releasing it for the same amount of time, and holding that exhale for the same amount of time. It's called box breathing. And it's something that's a really powerful tool, and it's free, right?
Absolutely. Guys, this next week, every day on Facebook at Drs. Warren, we're going to share a technique that's free that you can use and do at home that will help your body and your immune system be well. So go on Facebook at Drs. Warren, and let me go ahead and remind you guys, germ theory is just a theory. If germ theory were true, every single stinking virus and bacteria that you're exposed to would kill you. But you're still alive. Mm-hmm. And the studies here, Dr. Nathan's study,
with my toddler,
John all over it, says that if your internal environment is not well, that determines how you respond. And if it were really true, then we wouldn't be injecting viruses into cancer patients to help cure them, help figure out how we can make this happen. So what you do matters.
Yeah.
And let me go ahead and tell you, hand sanitizer is just going to make you more prone to it, okay? So we'll talk about that later in the show. But remember, guys, it's up to you.
Yeah.
You have to take care of yourself.
Yeah.
And just because you feel fine on the outside and you're on a medication or something like that doesn't mean you're well. You know when you're well, and your body should react to stressors appropriately.
Yeah. So this is Wellness Radio. We'll be right back after the break.
Oh my gosh.
All right, there we go.
When we come back on, I cannot wait. I want to share studies about grounding.
Oh, that's cool.
I want to share this article about vitamin C. We'll share it once we get back on the radio show. Because I want to tell you guys how vitamin C over and over again has been shown in the study. It said that in a viral infection, it can decrease the infection by a whole day. And to someone in your community, that whole day could be life or death.
Yeah, for sure.
Like, that's just so crazy that we're so flippant about it. But we'll talk about what the science says about vitamin C and grounding and all of that.
Oh yeah, I love it. So one of the things I wanted to kind of bring up here is when you're looking at, you know, this terrain versus germ theory. You know, to me, the biggest thing that we have to discover is that, you know, our internal terrain, right, determines how we react to our outside environment. And so that being said, one of the ways that we also know that this happens is, you know, just think about the difference between, you know, the 103 or 104-year-old that you read about that survived, you know, COVID-19, and then the 45-year-old that died from COVID-19. It's the same virus, so there's got to be a difference. And let me tell you what basically our media leaves it up to. Chance. Right? I mean, they don't ever explain it. They just basically, you know, tell you, well, this 104-year-old lived, but this healthy 45-year-old of 3 kids, you know, died from it. There was nothing that could, you know, happen from that. It was just happened, you know, it was chance. It was bad luck. You know, sorry, there's nothing you can do about it.
But walk outside with your face mask as your protection, where study after study shows that it doesn't really filter out a majority of virus particles. That's just scary. Yeah. That is scary. That is scary to think that, like, you can't do anything about anything at all, and all you can do is wear a face mask and hope for the best. And
the big bad wolf might just come and get you, right? With nothing that you can do about it. And that's just absolutely false. Why did the 104-year-old survive COVID-19 and a 45-year-old succumb to COVID-19? It's all about the internal terrain of the body. And we were able to, like, break it down and look. I guarantee you would see this person's body, right? The 104-year-old's body it's designed, just like the other person's body is designed to deal with stress. However, the internal terrain of the 104-year-old, again, is better equipped at this point to deal with the stressor of the virus, where this one is not. Why? Because of lifestyle factors. And again, it could even be, I will say, there are some lifestyle factors that, again, we can't quite control, right? Like, you know, I can't go out and turn on and turn off, you know, the air pollution that's outside of my house. I can only do so much about that, right? You know, so there are certain factors that, again, play a role that you can't help. But then there's other ones, like I'll see people wearing masks, and then I see them get in their car and they're smoking cigarettes. I'm like, what? Like, what? At what point did you miss that cigarettes are one of the most dangerous things on the planet?
I mean, I understand this, but even a lot of alcohol right now, I mean, liquor sales are like through the roof, and that's something that's just wrecking your body. And so that all really matters. This was really going to turn to. Did you use hand sanitizers during coronavirus? Yeah, and Lysol spray.
Lysol spray.
Yeah, I bet you it is, Angela.
No doubt.
Alrighty.
That's hilarious. There we go. We're getting a countdown. That's why we wait.
Hey guys, this is the Wellness Radio. Dr. Jordan here, Dr. Rebecca Warren, Dr. Nathan Warren. We are your local health experts here in Chattanooga, Tennessee, and nationwide. Virtually, we were doing Zoom before Zoom was cool.
Yeah,
so our online consult, because we realized years ago that we wanted to help and reach as many people, reach their health goals, get down to the cause, and be well. So our clinic is located in Hamilton Place, right across from the YMCA next to the Home Depot. We do structural corrective chiropractic care there. Also, the health coaching is there, as well as online. If you guys are listening to this and you're like, man, I like what they're saying, I'd like to make an appointment. If it's in person, we are focusing on in-person appointments just being about, you know, the spine, the nervous system, anything that you guys have, symptoms like pain or headaches like that. We can evaluate that off hours, one-on-one, so you don't have to worry about that. We followed all CDC guidelines in our office. Or if you want to figure out, hey, how do I get well? Overall, I've got these things going on. We get the virtual health coaching. For the whole month of April, that appointment can be at $250. We're just doing all appointments to come in or to do your virtual consult at just $45. I want to give you guys that number. That number is 423-362-5360. Again, that's 423-362-5360. 5360, and you can find out more information on doctorswarren.com. And so I want to talk about some things to help you guys through this time. And what's really frustrating is there's a lot of doctors that talk about how, this doesn't boost the immune system, this doesn't boost the immune system. Yeah, but they're missing the fact that we're living in such a unnatural, toxic world that we're all depleted. I mean, you just made a comment during the break on our Facebook Live that you can't control going outside. Actually, being inside your house is more toxic than even going outside.
Up to 100 times, according to studies.
Yeah. And so our cortisol is overwhelmed, and this is why I want to talk about this, because if you guys we want to talk, both of us, if you're not doing something today about your internal environment, you're just waiting around to be a statistic. And what we think healthy is very skewed, not just in America, but worldwide. We think we're healthy if we can manage our symptoms, if we can take something from symptoms, if we can push through. But when we hear about these quote unquote healthy people having complications, we don't know their health history. And I want to give an example, because, they said the youngest girl in Europe was 16 and, she died. And I don't want to talk about that, but we don't know what someone's health history looks like. And I think about all the young women that come into my office with PCOS, which, just so you know, it is insane how many women are being diagnosed with PCOS. And what is the treatment is birth control and metformin for some of the women. But what frustrates me is that women suffer through that, and they get on birth control, and some feel better on it, some don't. They'll get on metformin, and now they walk out of their OBGYN's office being told that they're well.
Yeah,
that
false
everything
sense of security,
is
right?
fine. And you want to know one of the comorbidities for complications from something like the coronavirus is blood sugar. Blood sugar issues, and guess what PCOS is? So, the same thing is like with heart attacks, the same thing is with cancer, the same thing with Alzheimer's, dementia, is that we have a body that's working to try to heal, but we have been exposed to so many stressors, and your job is to not only get down to the cause if you have symptoms, but to actively work on wellness. I got diagnosed with cancer at 19. I don't ever think eating well, taking my supplements, getting adjusted, I don't ever see putting all hundreds and thousands of dollars into my health over the years as something that's wasted. Until you sit in a doctor's office and you hear that you have cancer, everything that I do now pales in comparison. Yeah. Every day I work as if I have cancer, because I don't want to end up with cancer again. I don't want to end up with diabetes or blood sugar issues. And that's how you have to live your life now.
Yeah, but Dr. Rebecca, that takes work, right?
That takes money.
It takes
that
money.
Takes
it takes
time.
Work. But that's just bottom line. Anything in life you have to work hard for that's good. But here's the thing too. You were mentioning comorbidities. One of the most common ones that's so dangerous right now is high blood pressure, right? Because we know that has to do with ACE2, right? And when we're looking at the receptors that COVID-19 binds to, it has to do with ACE2 receptors. So the lower your ACE2 is inside of the body, again, the greater chance you have of COVID-19 being able to bind to those receptors. And so that's why what's one of the most common medications taken in the United States of America? It's what? It's high blood pressure medication, right? ACE2 inhibitors. And so we know this is a major, major red flag here. This is a comorbidity, no doubt about it. But again, it's been just so flippant over the years. It's like, I've even had, this is not a joke either. I have patients that have come in all the time. Why were you put on that blood pressure medication? Well, they said it was preventative. What? Like, it's prevented? You were put on a blood pressure medication just because in their mind, as you get older, your blood pressure just, happens to go completely out of whack and you're going to end up dying from a heart attack. And it wasn't at all, the million times that you drove through McDonald's line and picked up the fake meat and fake hamburger. It wasn't that at all. It wasn't the lack of exercise over the last 45 years. It couldn't have been, the amount of antibiotics that you threw into your gut. It definitely couldn't have been the amount of cigarettes that you smoke. It's definitely going to be, the lack of medication. That's the false mindset that's given out there. I have people that literally think that, again, if I'm not taking this statin drug, I'm going to die of a heart attack. So in their mind, they say that the only reason they're surviving is because of the statin drug, rather than recognizing the only thing that created your heart disease in the first place is the lifestyle that you just put your body in for the past 30 or 40 years. And so we have to recognize that if you died of a heart attack tomorrow, it's not because of a lack of, a statin drug. It's because of the 40, 50 years that you spent destroying your heart and your cardiovascular system. So we have to get away from that mindset as to thinking that, again, medication is the magic pill that's keeping us alive, because that is absolutely false. I respect medicine, actually I think to a higher degree than even most medical doctors, because I recognize how powerful medicine can be in an emergency situation. I gave a study. What was this? Probably, maybe now 3 weeks ago, I did a Facebook Live talking about vitamin C and the power of it. And I know you're going to give a study here, so I'm not going to talk about that one. But, there was one looking at sepsis patients, which kills on average over 60% of people with sepsis and septic shock. And it's a global issue. But they looked at, observational study of 47 people in the treatment group, 47 people in the control group. Control group got regular medical care, whereas the treatment group got a cocktail of, it consisted of hydrocortisone, vitamin C, and thiamine B1. And what they showed is the mortality rate in the regular medical control group was around 45%, whereas in the treatment group with vitamin C and thiamine, it was 8%. That big of a gap there, and yet we saw this information, and how many studies then came out about vitamin C? Because why? It's not a sexy drug, right? Thiamine, B1, it's not a sexy drug. And so that being said, if it's not a sexy drug, pharmaceutical companies don't want to have anything to do with it. And we know they're really the ones that are driving what your medical doctors are prescribing on a daily basis. Unfortunately, medical doctors no longer, even if they want to practice, medicine the way they were designed to and the way they were thinking about it, there's no art to it anymore, guys. It's determined by the pharmaceutical companies and the marketing that's being done, which is why they even took, Zantac, after being on the shelves for years, and people can literally grab it themselves. The FDA finally X'd it because they're like, well, too many people are being affected and harmed by it. Oh, you're only about 15 years too late for that, which is wild.
Yeah. And so let's talk about, so you talked about vitamin C, because in the first hour I talked about how these headlines are just really negative, and they're just catchy. Sweden is trying to not do strict lockdown, and all the headlines are like, it's not working. But then when you go to look at the study itself, the study says, oh, we have limited data, but we're just going to assume that it's not working, and so I had something
and
pulled up.
And their economy's not going to be destroyed after this, I promise you that, right?
So I had an article pulled up and it just closed down, but this is the one thing I want to talk about. So vitamin C, you know who they quoted in here?
Yeah.
Dr. I think his name is William Schaefer. He was on a morning talk with Brian Joyce and them.
Oh, really?
He was on the radio show talking about how vaccines and how we found out he had all this money invested in vaccine companies. But that's a whole nother thing.
Perfect.
They interviewed him for this. But so this is what they're saying. Vitamin C is crap. Vitamin C is, it's not going to cure anything, but we do know that vitamin C in studies has been shown to help with the common cold, which is a virus, just so you know, cancer, heart disease. But just because we have not studied it right now, it's crap. But we do know that it will decrease the duration of viral infections up to a day. And a day can be life or death for some people right now. And we know that vitamin C is essential for the immune system. We know that vitamin C is depleted when your cortisol is high. And most of you guys, cortisol is through the roof. So we know you're depleted. The crazy thing is this. In the study that they found that it can decrease duration for up to a day, they only did 2,000 milligrams. Guys, the people in my office, the minimum they take is 2,500.
Yeah.
Right now, people are taking...
we have
8,000.
Some people that are taking a lot more than that for sure.
Yeah, so the vitamin C, we like liposomal, we like Dr. Mercola, Sufficient C. You can go to our
Quicksilver Scientific.
Go to Facebook. We have a whole vitamin C and vitamin D video on that. And if you guys need help right now, if you're at home and you're like, I got to do this. Now more than ever, I got to take care of myself. I want to be well, whether you're in pain We can see you in the office for that one-on-one, or, you know, in regards to virtual coaching, we do that as well. That first consult is to determine what's our next game plan for you. What's our plan of action for you? Those appointments could go up to 150, and they're just 45 for the month of April, whenever you guys call. So that number's 423-362-5360. But you can call now. Maribeth is standing by to get you on our schedule.
Yeah, absolutely. And I was going to mention too, you know, we look at vitamin C and we say things like, well, it's, you know, it's research based, or it's not research based in the literature. And we're going to go into why it is and why that is an absolute, you know, basically just an excuse to not, you know, because it's not a sexy drug. So again, stay tuned, guys. This is Wellness Radio. We'll be right back after the break. All right, so what I was gonna say, because I didn't realize that we were running, I wasn't paying very good attention. I didn't realize we had to go on break there.
Listen, I just want you guys to know we're looking at our engineer. Okay, this poor guy is probably like, they never stop talking. He's like, break. Listen, we could talk the whole hour straight through.
Yeah.
But
what I was gonna say is this. You know, they throw out in this type of thing. Oh, vitamin C just hasn't been studied enough to say these things. We need more research on vitamin C. But yet you guys are okay with them saying, you know what? But we're gonna fast track a vaccine really soon. We're gonna we're gonna spend less than a year. We're gonna skip animal studies, go right to human studies, and then we're gonna distribute this thing worldwide. Woohoo! Hooray! Let's do it. That's the lack of research? Are you freaking kidding me? We're okay with that. We're okay with saying, yeah, just fast track it, no problem at all. We have no idea what's gonna happen, but yeah, do it, man. But yet we look at something like vitamin C that's been around for so long and we say that there's not enough research. Again, that is an excuse that is used the majority of time from pharmaceutical companies or people that are compensated by pharmaceutical companies. Again, there's plenty of research on vitamin C. And actually, one of the things that you guys are going to see over time, especially through this, is you have places like China that right now they're doing 2 double-blind randomized clinical trials with vitamin C, IV vitamin C, and they're doing 1 triple-blind clinical trial, which is going to, again, by the end of this, you're not going to be your local physician that thinks they know everything about, you know, medicine and vitamins and minerals, which they have no idea about vitamins and minerals, that say vitamin C is not good. They're no longer going to be able to say that. Again, there's not even going to be a debate about it. And what it's going to end up doing is it's going to end up saving millions of lives, because it will, mark my words, it will become, you know, again, unless pharmaceutical companies stop it, it will become the primary way that you deal with sepsis and septic shock, because our preliminary studies have shown amazing results with that. Again, I talked about the study with vitamin C, B1 or thiamine, and hydrocortisone, which again, they're now using that as well. We know that places like New York City, that part of the intensive care for COVID-19 patients is doing 1,500 milligrams IV, again, 3 to 4 times a day, which, you know, again, even in my book and from what I've seen from orthomolecular medical doctors who've worked with vitamin C pretty much their entire career are saying that even that is too low. But yet, even with that low dose, they're seeing major improvements in patients. But yet again, it's not being shouted from the rooftops. You know, all we hear about is, you know, different apocalyptic type language. So we want to make sure that we know that COVID-19 is a serious issue and it does affect people's lives. But at the same time, there is a lot that you can do for it at home, building up your internal terrain. You know, while you're at home, you know, are you taking time to move? Are you exercising? You know, are you taking, and again, it could be at different levels. Are some of you that can't move very well, do you have your chair out and are just doing chair squats, right? For 30 seconds to a minute and then resting and then repeating that, you know, 3 to 5 times. Are you, you know, those of you that are more fit, you know, are you taking 5 to 10 minutes to do body weight exercise and stay fit throughout this process? You know, are you doing the right things that even though you may, you know, in your pantry have something like, you know, Frosted Flakes and Cheerios that look so good, are you, rather than that, are you choosing to eat some pasture-raised eggs, you know, in the morning, and avocado, and eating vitamin C rich foods like red bell pepper and things like spinach and leafy greens and blueberries and strawberries? You know, what are you choosing to do at home? Because it does matter. Are you choosing to invest your money with your health into things like vitamin D3, which is absolutely phenomenal as an immunomodulator and a pro-hormone? Are you investing in things like vitamin C? And are you decreasing your investment in reading crap online that you shouldn't be reading in the first place?
This was all really good. You're probably going to have to repeat that on the radio.
I know.
That was really good. It all matters, guys. Protecting yourself right now. All of it matters. All right, we're about to go live. Back on the radio.
All right, guys. Welcome back to Wellness Radio. I'm your health expert, Dr. Nathan Warren, and I'm here.
Dr. who? Dr. Mark?
Thanks for making fun of me. That was super nice. Yeah, it makes me feel really, really good.
Listen, we gotta laugh nowadays. We just gotta have good attitudes, and I'm gonna make fun of you if I need to.
Oh, thank you.
So get a good
I
laugh.
appreciate that. At my expense. Oh,
At
that
your
sounds
expense.
really good.
Yeah.
That's okay. I give you permission.
Thanks.
Maybe that gets me some brownie points.
I was gonna
for
do
you.
it regardless.
Oh, okay. Yeah.
Hi guys, so this is the Wellness Radio. We're so excited to be doing this 2-hour show. This is our second hour. We are wellness practitioners and doctors of chiropractic. We have structural corrective chiropractic clinic here in Chattanooga and do functional wellness. So what does that mean? And I say this to get down to the cause.
I stole your thunder. That was for making fun of me earlier.
You did. You took my it's the root cause. Anyways, so what that means is that you have plenty of doctors out there that can treat your symptoms. That's not what we're in this to do. You know, we're so passionate just from our own, story, but even for myself, I'll share, I've had some really difficult cases come in. Difficult in the sense of my heart breaks.
Yeah.
Like my heart breaks that people are not well for so long and their doctors aren't helping them, but they'll come in and tell me that, but they're a nice dude or they're a nice woman.
And
I'm
I
like,
played golf with them for 5 years.
Who
You're like,
says that?
dude, but they're killing you at the same time.
that's true. Or they're just nice. He cares. I'm like, yeah, but you're dying. You're literally slowly dying. And so it overwhelms me in the sense of it breaks my heart that there's so many people that felt fine until they weren't fine.
Yeah.
And the people, I'll go ahead and tell you this because this might be you. I'll sit across from people and it's always the same people that sit there and look at me just tired and say, I don't even like medication. I don't even like taking medication. And then I look at their paperwork and they're on 7 of them. It doesn't just happen. You just don't, it's not by chance. If your body has symptoms or, because we're living in a world where things are different now, not if you have no symptoms, symptomless, but you're not actively working on your health. I don't care if you have 0 symptoms, but if you're not actively working to push your health forward, you're taking time bomb. We know that. And so, I getting diagnosed with cancer at 19 and sitting in a room feeling very hopeless and not knowing what the future looks like, especially at such a young age, has taught me to value not only my health, but it's committed me to doing this. And you have, your health history with your mom and, even your own, just seeing from one thing I love about you is that you have a heart for people that don't have a voice, people that are being taken advantage of. This is our mission field, is to help you guys here online, to help you guys in our city. And so if you do need help with your health, our clinic is still open. And my gosh, are we working so many hours to spread out the appointments and follow CDC guidelines. So if you need help, with pain, headaches, back pain, what is it that people have? I don't even know, knee pain and all these things. Our clinic is open. We are an essential healthcare business. But if you'd like to get health coaching, we can do that in office off hours. But we also have a virtual option. And so for the month of April, with everything that's going on, instead of 150, we're just doing it for 45. So you can save our number. Our number is 423-362-5360. Again, that's 423-362-5360. Or Mary Beth is standing by. She is scheduling people, messaging me here on my phone. And you can find out more about us on drzorn.com.
Yeah, and I was gonna say this. I was gonna share a story because I thought this was cool. Because I saw this patient this past weekend. I think it was last Friday or Saturday when we were open for an hour before our radio show. And Chelsea actually worked for us for a while, right? And she was, absolutely fantastic person, really, really great. But when she came in and saw us and started working with us, we work with our, the people that work with us, their health too, right? We care about that. And so we started working with her, who had dealt with, was it ulcerative colitis, I believe, or Crohn's disease? Crohn's, that's what it was. So Crohn's, and she had dealt with that since she was a little girl, to the point where they had talked about, actually removing part of her intestine because of this serious issue.
She
and
was on
also
chemo drugs,
yep.
Had lupus,
tested
positive for lupus, bleeding. I mean,
she was taking do you remember when she made the jar? I'm talking literally 24 to 36 pills a day, right, is what she was taking for her Crohn's disease symptoms and her lupus symptoms as well. And again, what was really cool though is, over time, right? Over time, we worked with her body. We were able to do things like, again, start correcting the spine, which, remember, structure controls function. Again, helping her nervous system to function optimally. We did things like, we radically changed her diet, in the foods that she was bringing into that digestive system. We worked on proper supplementation and nutraceuticals to help actually close up the lining of the gut, do things like reduce inflammation, calm down an overactive immune system. So not only when she was still working with us, she actually got off of all of her drugs, right, with the help of her medical doctor because of how well she was doing. So she stayed off of them, right, for over 2.5 years. And guess what she is now? She's pregnant, right? And she's pregnant. And so what's amazing is she told me more than 2.5. I don't even know. I'm in a black hole at this point with time. But one of the cool things that she told me on Saturday, she said, now I'm having to think about all of these things with my pregnancy and how I want to give birth and everything, because I never thought I could ever be able to do that. And I almost started crying, but because I have to be tough, this tough guy, I held it in, and I in that moment, I was like, man, that's everything right there, right? That is absolutely everything. That again, this thought that she just basically had written off even as a little girl, that she would never be able to have kids. And now she's able to, because we started getting down to the root cause of the health issues. And here's what I'll say, which is this is so cool. And again, I would always challenge, when's the last time your medical doctor told you this? It wasn't my adjustment that got her well. It was not the nutraceuticals and the supplements that she took. It wasn't even the food that got her well. You know what it was that got her well? It was the function of her innate healing system that lives inside every single cell of her body. It was her body that did the healing, right? And what's amazing about that is it now has given her confidence. And I guarantee you that baby will be raised completely different. Her or his lifestyle will be completely different than what hers was growing up. And so that's generations that are changed by a shift in mindset. Right? A shift in mindset saying, hey, you know what? My body is created to heal. You know what? My body is designed to heal on a regular basis. You know what? The decisions that I make on a regular basis add up over time, and they lead to something amazing that God gave us from the very beginning, and that is the right to health. And I think it's so amazing to see that. And so I know there's so many people out there that, they think a similar way. And for them, maybe it's not having kids, but maybe it's, you know what? I'm not going to ever get to play with my grandkids again outside. Or maybe it's, you know what? I can't hike. I can't move. I can't play golf anymore. I'm never going to be able to go to the grocery store again because, I'm literally always looking for a bathroom because I have irritable bowel syndrome. Whatever it is for you, again, that is what we want to help you with. That is what we want to work with you with, not because we have a magical pill, but because we have literally based our practice and our foundation of what we do with patients on this fact that your body is created to heal, that there's always a root cause to the problem. And so if you're listening, you want to come in and see us in the office, again, that number is 423-362-5360, or if it's virtual, right, wherever you're at, maybe you're in California or in Florida, or you're in Texas, or you're in Pennsylvania, or if you're in Michigan, wherever you're at, and you want to start working on your health issues and really get down to the root cause, that's what we do, again, virtually as well. And so instead of it being $120 to $150, guys, we're doing it right now now because we know so many people are trying to work on their health and we want to be able to do that with you and partner with you in that. It's only $45. So again, you can give Mary Beth a call. That number is 423-362-5360, and I can't wait. It's going to be amazing.
I just want to make a side note. Like, I almost started, like, Chelsea, I love her. You know, I almost started crying hearing that story. But you didn't tell me that. That was my first time hearing it. Anyways, I just got to get on.
There's so much that I forget.
He gets cool, healthy snacks from people.
No, I hide those on purpose.
No, yeah. Anyways, this is the Wellness Radio, guys. We'll see you right after the break.
All right, guys. Yeah, so I think sometimes Dr. Rebecca, on a daily basis, she's like, you need to work on your brain, right? You need to work on your brain, right? I need to work on my brain too. So we're always working.
No, I don't say work on your brain. I say, you never tell me anything, and you never share the paleo snacks that
Why would I do that?
Carrie
I
in
want
our
them for
office.
myself.
Carrie made this amazing, guys. If you can eat really, this amazing chocolate, like peanut butter cup, and he's hidden it like in the back of our freezer and like in the fridge in our office, and he just pops up eating this delicious like paleo.
Oh, it's
so
good,
rich.
yeah.
Anyways,
I know I would never get it if I don't. Like, I get home and you got Dr. Rebecca over here, and then you got the kids. They're gonna swamp me if they see anything like that. So, but yeah, speaking of that, guys, you can eat amazing. And like it tastes good and still take care of your body. And my men's group right now is they're seeing that, man. They're posting
cool.
pictures. I know. They're posting pictures of like, their ketogenic meals, and they're having like amazing grass-fed, grass-finished steaks with like, this huge serving of broccoli and things like leafy greens, with olive oil and grass-fed butter and sea salt all over and lemon juice. They're posting these pictures of amazing smoothies with like coconut milk and blueberries and all of these healing foods, bone broth. And it's just like, you start to realize that, again, we've been sold this lie that says that if you want to be healthy, you're going to, number one, you're going to be one of those weirdos that, buys weird food, and you're going to be eating barley grass the rest of your life. And that's just not the case. It's not the case at all.
He does eat that, but yeah.
Yeah, I'll eat and drink that stuff just, because I don't enjoy it, but I know what it's doing inside of my body.
But
right?
that's 15 years of eating healthy.
Oh yeah, exactly.
Not right off the
and it's
bat.
such a small portion of what we do, right? The majority of what we do, it tastes amazing, and you guys can do that at home. The food that you consume, remember, it's the building blocks of your cells, right? So your cells literally take that information in, and it's what drives the production of good, new, healthy cells, and what also helps to drive the production of being able to get rid of and kill off damaged parts of cells like autophagy. We know there's certain foods that drive autophagy, right? Like organic green tea, right? Organic black tea. These are things that do that. Things like antioxidant polyphenol-rich foods like blueberries, blackberries, these dark, rich berries. Things like mushrooms that are really dark, cacao, raw cacao, which is one of my favorite things to put into my coffee on a regular basis. Speaking of coffee, organic coffee can even do things like raise your autophagy.
You're gonna talk about coffee?
I can talk about
with coffee
all the time.
Well, this is the crazy thing. I had 2 different experiences with 2 of my coaching clients, and one of them, she actually in the same day, 3 people told me this. But anyways, she told me, she was like, on the paper, she in her paperwork before we went on, she was like, I'm really struggling. I'm restricting a lot, and then I'm binging on sugar. Who's gone through that? Like, you yo-yo, like you restrict, and then you go. And so I told her, I go, what are you binging on? Like, oh, it's brownies and it's chocolate. Okay, cool. Then eat this brownie, then eat this chocolate. Eat it.
And they're like, what? Wait,
eat
what?
it. Like, eat it for breakfast if you want. But you're going to use
But
Swerve.
what kind?
You're going to use Swerve. You're going to use Lily's. You're going to use huge Lakanto. Like, this is the thing. If eating healthy didn't taste well, we wouldn't be doing it. But there's a lot of, this is good, this is bad, this is good, this is bad. When you have to take a step back and say, this is nourishing. Chocolate is nourishing. Yeah. It has a lot of antioxidants. It's amazing. But not Hershey's crap $1 bar.
Yeah.
So you can eat those brownies and those cookies with nourishing ingredients. not these are bad.
Yeah, that's right. I think that's an amazing point, right? There's a difference there, and we live in a modern world where you can have those, right? How cool is that? That like literally you can have like, I want some brownies. I can literally go to the store and I can get something like Swerve that's made with almond flour and coconut flour and made with real whole food ingredients, and it's sweetened with something that's not going to drive up my blood glucose and my insulin levels. So again, that's a blessing.
Yeah, Alexis, you and I talked about that. Yeah, good.
All right, guys, welcome back to Wellness Radio. I am your health expert, Dr. Nathan Warren, and I'm here with my beautiful wife, Dr. Rebecca Warren. I don't know, you're like smiling at me. I can't help it. Her smile is so beautiful. It just makes me happy.
Thank you. All right, they can't even see us on the radio.
I know,
so
that's
this
true.
Is the
They're
Wellness
like, what
Radio,
a weird,
guys.
what a bunch of weirdos, right? That we're listening to.
Guys, we are your wellness doctors. We're in a really great mood.
Yeah.
Life is crazy. Things are overwhelming.
Mm-hmm.
All right, listen, Mary Beth. Let me go ahead and tell you this. I did want to touch on this. Our clinic director messaged me something. So our mayor in Chattanooga decided that you can't drive in to church
with your windows
closed. You can't drive into church, Mayor. You cannot drive into church with your windows closed, or you'll get in trouble. I guess with the law.
I'll tell you right now, I'm seriously questioning your intelligence at this point. I'll just say this.
It's just the windows closed. Anyways, but again, we're walking around with cloth. He's completely fine with all these people at stores with these, masks that aren't protected. I mean, we're living in some
Amazon
crazy
factories
time. Our
that are
Amazon
right next
factories
to each other,
were hundreds of them.
Even
Volkswagen, but Volkswagen just had to let all these people go because the economy is going to be really tough. So we can't drive in with our windows closed to church. Can someone message me on Facebook? If anyone knows the mayor, can you message me on Facebook and tell me what's kind of like the study, the reasoning, the foundation in regards to how that compared to people that are literally anxious, depressed, overwhelmed, that need to be around their community. I mean, I just don't get it. But this is why we did a 2-hour show, because if you don't stinking ask questions, your health, your freedom, your liberty is in someone else's hands. If you're not taking care of your health, when you lose it, when you lose it completely, and if you're in the hospital, your health is no longer in your hands. When you lose your freedoms and you don't question why, you don't wonder why, you don't look at the research or the stats, it's no longer in your hands. So in all areas, we just challenge each and every one of you to think critically about the information you're being sold, from the news to the pharmaceuticals, like from medicine, from your insurance company. Question everything and then fight. Fight for what's right.
No doubt.
Right now, if there's things that are going on in your state, in your city that is not right, you have the ability to vote. You have the ability to show up. You have the ability to petition. You have the ability to do that. If you are afraid of this virus, then you have the responsibility and the ability to protect yourself, to protect your family. Yeah, okay, stay home, but work on your immune system. Work on your body's ability to adapt. You and only you are 100% responsible for what ends up happening in your life. No one else. Both with your liberties, your freedom, and your health. It's all on you.
Oh, it's so good, man. That's really good. You should run against Andy Burke, right? I would vote for you in a second over that guy.
This is so crazy to me. Like, you can't even drive up with your window closed.
I know, right? What a joke.
And these poor cops, I'm sure these cops are like, I don't want to be talking to people. I don't know. So,
well, and think about it too. You're doing that, and it's like it's probably the same. He probably has the same ideals that says, hey, you should also tell on your neighbor, right? If they get too close outside with their dog, you should probably tell on them, right? Let's report them, guys. That's insane. That's not the country that we grew up in. That's not the country that was founded here at all.
Windows closed.
Anyways, we gotta go. We gotta go here on Wellness Radio. But again, guys, you want our help? 423-362-5360. Come into our office, see us virtually online. It's only $45 to come in and see us, guys. We'd love to be able to work with you. Again, 423-362-5360. And as always, go on Facebook, like us at Doctors Warren, follow us, be able to ask questions. We love you guys, and we'll see you guys next week.
Well, thank you guys for sticking it out. We had a lot of people here throughout the show. You guys, if you want our assistance, see our website.
Alexa says you should run for office too, right?
Stop it. Don't feed this to him, guys.
Oh, man.
One of us might. We'll see. One of us might, but...
I mean, we do. I think we get passionate because we can't just sit back and just, you know, be okay with our freedoms being taken away. You know, it's just not okay, man. I know we've got to make sure that we're also protecting the world that our kids are going to live in, that our grandkids are going to live in. And when you start doing things like crossing the line between, you know, church and state, that's a dangerous thing. I'll tell you right now, I wouldn't want to cross the Holy Spirit. Better get in for a fight, buddy. That's incredible, you know. But and then too, like, you know, just kind of driving the idea of telling on people and all this kind of stuff. Like, that's not the country we're in. And so we just say, like Dr. Rebecca said, you know, think for yourself, right? Take care of you, take care of your family, build up your health, right? Focus on what matters, get rid of the negativity that's out there, get rid of the, you know, the reading your articles on your news feed, you know, and also too, it goes both ways, right? Don't go down rabbit holes of ridiculous conspiracy theories either, you know, again, because those can be just as negative, I promise you that. So again, just take care of you and you can do so much. Right, guys? But anyway, love
Easter.
You guys. Happy
Easter,
man. Oh, yeah. Good
Happy
point.
Resurrection Day.
Woo, man.
Guys,
it's going to be amazing. I know.
Anyways,
we should have said that for sure.
You guys have a great weekend, and we'll see you next week.
Bye.